If you are over 55 and you wake up at night with leg cramps, you need to hear this right now. A study published in PLOS One using data from the National Health and Nutrition Examination Survey, tracking over 15,000 American adults, found that nighttime leg cramps were significantly associated with coronary heart disease, heart failure, and angina, not separately, together, at the same time. And a landmark geriatric study published in the American Journal of Cardiology followed 1,802 older adults and found something that should be on the front page of every newspaper. If peripheral artery disease, blocked leg arteries, was present in a patient, coronary artery disease was also found in 68% of those same people. 68%. Not a minority, a majority. In the next 12 minutes, I am going to show you exactly which cramp patterns are warning signs of blocked heart arteries, why the gap between what research shows and what happens in everyday medical visits is costing lives, and one simple 2-minute test you can do tonight at home with no equipment and no cost that can tell you whether your nighttime cramps are a message your body is desperately trying to send you. Before we go any further, drop a comment right now with just one word. Tell me which leg cramps you most often. Left? Right? Both. Just that one word. I want to see who is watching because what I am about to share is going to hit very differently depending on your answer. And if your cramps happen in the same leg every single time, never switching sides, add the word same to your comment. You are going to understand exactly why that matters in about 3 minutes. Here is what is happening in homes across this country every single night. A 64-year-old woman wakes up at 2 in the morning with a cramp locked deep into her right calf. It is brutal. She stretches it out, walks it off, and within a few minutes the pain fades. She goes back to sleep thinking it is probably her potassium. She will eat a banana in the morning. That same cramp comes back 4 nights later, then twice the following week. She mentions it to her doctor at the next appointment. The doctor nods, says it is very common, suggests a magnesium supplement, and moves on to the next item on the checklist. That story is not rare. It is not a dramatic exception. Research presented in the Journal of Vascular Surgery confirms it plays out in hospitals and cardiology clinics across this country, every single day. And the reason it keeps happening comes down to one thing. Most people, and genuinely many physicians, have been trained to treat nighttime leg cramps as a muscle problem, a hydration problem, a vitamin deficiency, something you stretch out and forget about. They are not always a muscle problem. Here is what most people do not understand. The same disease that is silently narrowing the arteries feeding your heart is the exact same disease narrowing the arteries feeding your legs. It is called atherosclerosis, a slow, invisible buildup of cholesterol-rich plaque along the inner walls of your arteries. And here is the critical point that changes everything. It does not happen in one isolated location. The American Heart Association's 2024 Scientific Statement on Peripheral Artery Disease, published in Circulation, states clearly that PAD is a manifestation of systemic atherosclerosis. Systemic, meaning your entire vascular system. When one part of that pipeline is narrowing, the rest of it is almost certainly narrowing too. This is why the 2024 ACC/AHA Guideline for the Management of Lower Extremity Peripheral Artery Disease, a comprehensive document produced by 11 major medical societies including the American College of Cardiology, the American Heart Association, the Society for Vascular Surgery, and the Society of Interventional Radiology, formally reclassifies PAD not as a leg problem, but as a systemic cardiovascular disease carrying a markedly increased risk of heart attack, stroke, and cardiovascular death. That story is not rare. It is not a dramatic exception. Research presented in the Journal of Vascular Surgery confirms it plays out in hospitals and cardiology clinics across this country every single day. And the reason it keeps happening comes down to one thing. Most people, and genuinely many physicians, have been trained to treat nighttime leg cramps as a muscle problem, a hydration problem, a vitamin deficiency, something you stretch out and forget about. Here is the number that should make every person over 50 sit up straight. Research published in the journal Vascular Health and Risk Management using National Health and Nutrition Examination Survey data found that among adults over 70 years of age, the prevalence of peripheral artery disease was 14.5%, nearly 1 in 7. Most had no idea. And from the landmark American Journal of Cardiology study of 1,802 geriatric patients, if PAD was present, coronary artery disease was also present in 68% of those patients. Your leg arteries and your heart arteries are telling the same story. The question is whether anyone is reading it. Now I am going to walk you through the 8 cramp patterns that research links to blocked arteries. Not general cramps, specific patterns, because pattern is everything here. Warning sign 1, the cramp that always hits the same leg. When leg cramps are caused by dehydration or low electrolytes, the mineral imbalance affects your entire body equally. Both legs face the same environment. But when one leg cramps repeatedly, same leg, same location, same time of night, night after night, that is what vascular physicians describe as a vascular fingerprint. The Edinburgh Artery Study, one of the most cited long-term population studies on peripheral arterial disease, established that arterial blockages almost never advance at exactly the same rate in both limbs. One side progresses faster, and the leg that keeps cramping is pointing directly at which artery that is. If your right calf cramps 4 nights this week and your left leg is silent, that is not random. That is your vascular system marking a location on a map. Warning sign 2, the cramp that starts within the first hour of lying down. Most people assume cramps happen after deep sleep, after hours in bed. But think about what happens when your body transitions from standing to lying flat. The muscular demand on your leg arteries changes completely. And if those arteries are significantly blocked, some people experience what vascular physicians call ischemic rest pain, muscle tissue that cannot get adequate oxygen even when the body is perfectly still. The 2024 ACC/AHA Peripheral Artery Disease Guidelines specifically cite rest pain as a defining clinical feature of advanced arterial insufficiency. A cramp that hits you within 30 to 60 minutes of getting into bed, before deep sleep even begins, is far more consistent with arterial insufficiency than with simple muscle fatigue or dehydration. Warning sign 3, the cramp that gets better when you hang your foot off the bed. This one is almost textbook in vascular medicine, and almost nobody who experiences it knows what it means. When leg arteries are significantly blocked, lying flat means blood has to fight gravity to reach your feet. But the moment you dangle your foot over the edge of the mattress, gravity shifts in your favor. Blood flows more easily downward toward the foot. For many people with blocked leg arteries, this position change actually eases the cramp within minutes. Physicians at the Cleveland Clinic and Mount Sinai Medical Center's vascular surgery programs both document dependent leg positioning, hanging the foot down, as a classic compensatory behavior seen in patients with peripheral artery disease. If you have ever found yourself sitting on the edge of the bed at 3 in the morning with your feet on the floor because it helped, your body was engineering its own workaround for an arterial blockage. Warning sign 4, cold feet paired with the cramp. If your nighttime leg cramps come with feet that are noticeably colder than the rest of your body, or one foot that is clearly colder than the other, this pairing is a significant red flag. When leg arteries are narrowed, the extremities are the first to lose adequate blood flow. Your body is always prioritizing circulation to vital organs: the brain, the kidneys, the heart. The feet and lower legs receive what is left over. The 2024 ACC/AHA guidelines on lower extremity PAD identify cool skin temperature in the lower leg or foot as one of the physical examination findings consistent with peripheral arterial disease. Cold feet and cramping together are a pairing that vascular specialists classify as a clinical combination requiring evaluation, not a coincidence to dismiss. Warning sign 5, a specific stopping point when you walk. This one you may notice during the day, not just at night. Many people with blocked leg arteries can walk approximately 2 blocks or climb one flight of stairs and then feel a tightening or cramping in their calf that forces them to stop. They rest for a minute, the pain fades, they walk again, 2 blocks, same cramping, stop again. This is called intermittent claudication. The American Heart Association describes it as the hallmark daytime symptom of peripheral artery disease. The word claudication comes directly from the Latin claudicare, to limp. If this pattern sounds familiar to you from your daily life, the nighttime cramps you wake up with may be the advanced form of the same underlying problem. The stage at which the muscle is not getting adequate blood flow even at complete rest. The 2024 ACC/AHA guidelines explicitly state that claudication limiting daily activity is a direct indication requiring formal vascular evaluation. Warning sign 6. Cramps paired with a wound that will not heal. If you have a small cut, a blister, or any skin break on your foot or ankle that has been there for 3, 4, or 5 weeks and is not closing the way you would expect, and you are also waking up with recurring nighttime leg cramps, please do not wait on this. When blood flow to the lower extremities is so reduced that even minor tissue damage cannot repair itself, the tissues are in a state that vascular researchers call chronic limb ischemia. Persistent oxygen deprivation. Mount Sinai Medical Center's vascular surgery program and the Society for Vascular Surgery's clinical guidelines both identify non-healing wounds on the lower extremity combined with leg pain as indicating significant arterial insufficiency requiring immediate evaluation. In the United States, approximately 70% of all non-traumatic lower extremity amputations occur in patients with diabetes, and nearly all involve the same underlying mechanism: blocked arteries that could not deliver enough blood to heal tissue. Warning sign 7. A cramp pattern that is escalating, not resolving. Everyone gets the occasional cramp. One night of intense exercise, a hot day with too little water, a new medication. These cramps come once or twice and disappear. Vascular cramps follow a completely different trajectory. They begin mildly, then they return more frequently. Then they wake you up more nights than not. Then they start hitting earlier in the night. The cramps that should alarm you are the ones that are systematically getting worse, more frequent, longer lasting, more intense, over a period of weeks to months. This progressive pattern directly mirrors the nature of the disease. Atherosclerosis does not plateau and wait. Plaque accumulates steadily. Arteries narrow progressively, and the symptom pattern escalates in lockstep with the disease. Research published through the Journal of Vascular Surgery confirms that the natural history of untreated peripheral artery disease follows exactly this trajectory of gradual but continuous functional decline. Warning sign 8, and this is the one I need you to sit with. This one is not about the cramp itself. It is about who is having the cramp, because context changes everything. If you are over 55 and you have ever smoked, even decades ago, the Edinburgh Artery study found that smoking carries an odds ratio of 4.46 for developing peripheral arterial disease. That means smokers face more than 4 times the risk compared to non-smokers. Smoking directly damages arterial walls at a cellular level and accelerates plaque formation faster than almost any other single modifiable factor. If you have diabetes, the CDC and the American Heart Association's 2024 statistical update both report that individuals with diabetes face a 2 to 3 times greater risk of developing peripheral artery disease compared to those without it. If you have high blood pressure or high cholesterol, especially if these have been inconsistently controlled, you are carrying the precise risk factor combination that the 2024 ACC/AHA guidelines identify as driving the highest rates of both PAD and concurrent coronary artery disease. And if anyone in your immediate family needed leg bypass surgery, had an amputation, or suffered a heart attack before age 65, your genetic risk compounds every other factor in this list. A cramp in a healthy 35-year-old with no medical history is one thing. A cramp in a 63-year-old with diabetes, a 20-year smoking history, and a father who had a heart attack at 58 That is your body using the last language it has available to tell you something urgent. Now here is the part that still shocks me. There is a test you can do right now, tonight, with no equipment, no prescription, and no cost. It takes 2 minutes. Most doctors are not teaching this to their patients, but you are going to know it before you go to sleep tonight. It is called the Capillary Refill Test. Here is exactly how you do it. Sit in a well-lit room. Take your thumb and press firmly on the nail bed of your big toe. Press hard enough that the nail turns completely white. Hold that pressure for 5 full seconds. Then release. And count the seconds until the normal pink color returns. In a person with healthy arterial circulation, that pink color returns in 2 seconds or less. 1, 2, done. If it takes 3 seconds, 4 seconds, or 5 seconds to come back, that is called a delayed capillary refill. It tells you that blood is not reaching your toes efficiently or quickly. Now do the same test on your other foot. Compare the two results day by side. If one foot consistently refills more slowly than the other, that asymmetry is clinically significant. Write down your results. Both feet, the number of seconds. Bring that information to your next doctor's appointment. And when you get there, ask specifically, by name, for an Ankle-Brachial Index test. The ABI is a painless, non-invasive test in which a technician places blood pressure cuffs at your arm and your ankle and compares the pressure readings. A ratio below 0.9 is considered diagnostic for peripheral artery disease, according to the 2024 ACC/AHA clinical guidelines. It takes approximately 15 minutes. It is covered by most insurance plans for patients with cardiovascular risk factors. A Danish clinical trial published in the medical literature and cited in the 2024 ACC/AHA guidelines found that systematic screening for PAD using the Ankle-Brachial Index in men aged 65 to 74, followed by appropriate management, reduced all-cause mortality by 7% over 5 years. 7% from a 15-minute test. According to data cited in the 2024 ACC/AHA lower extremity PAD guidelines, PAD affects over 230 million adults worldwide. In the United States, the National Health and Nutrition Examination Survey data shows that among adults over 70 years of age, prevalence approaches 14.5%, and the majority of those affected remain undiagnosed. Here is what I need you to carry with you after this video ends. The landmark geriatric study from the American Journal of Cardiology found that when peripheral artery disease is present in older adults, coronary artery disease is also present in 68% of those same patients. Your leg arteries and your heart arteries run on the same system. They are degraded by the same disease. The leg is a window into the heart, and your nighttime leg cramps may be the earliest, most accessible warning your entire cardiovascular system is capable of giving you. Before chest pain ever begins, before any stress test comes back abnormal, before any cardiologist sees your name. Your legs are talking right now. The only question is whether anyone is listening. So here is exactly what I want you to do. Tonight, not next week, do the capillary refill test I just described. Both feet, note the numbers. Second, starting tonight, keep a cramp journal for 2 weeks. Write down which leg, what time, how long, and whether dangling your foot off the bed brought any relief. Third, look honestly at your risk profile. Diabetes, smoking history, high blood pressure, high cholesterol, family history of heart disease or stroke, age over 55. If you carry 2 or more of those factors and you are having recurring nighttime cramps, this is not a conversation to delay until your next scheduled physical. Fourth, when you do see your doctor, ask specifically for an Ankle-Brachial Index test, not a general checkup, that specific test by name. Fifth, and this is important, if your cramps are escalating right now, happening more nights, lasting longer, starting earlier in the night, call your doctor's office this week and use these exact words: progressively worsening rest pain, Rest pain is a clinical term recognized by every vascular physician and every medical office. It communicates urgency in a language the healthcare system is trained to hear. Here is what you now know that most people your age, and honestly, many general practitioners, do not yet fully apply in clinical practice. Nighttime leg cramps are not always a potassium problem. The PLOS-1 study using NHANES data found direct associations between nighttime leg cramps and coronary heart disease, heart failure, and angina. The American Journal of Cardiology Geriatric Study found that PAD and coronary artery disease coexist in 68% of patients. The 2024 ACC/AHA guidelines of 11 medical societies now formally classify PAD as systemic cardiovascular disease. The Ankle-Brachial Index, a 15-minute painless test, is the first-line diagnostic tool endorsed by those same guidelines. And a Danish trial proved that using it proactively saves lives. You know the 8 specific cramp patterns that separate a vascular warning from a benign muscle cramp. You know how to perform a capillary refill test tonight with no equipment. You know how to ask for an Ankle-Brachial Index test by name. And you now know that the gap between what is in the research and what happens in a 15-minute medical appointment, that gap is real, and it is your job to close it for yourself. You are now more informed about the cardiovascular significance of nighttime leg cramps than the vast majority of people your age. And that knowledge is not just interesting. It could be the difference between catching something early enough to intervene and finding out when it is no longer early. If this gave you clarity, if it answered something you have been quietly wondering about, or gave you language you did not have before, drop the word "aware" in the comments right now. It tells me this information actually reached you. And please share this video with someone over 55 in your life who wakes up with leg cramps and writes them off as nothing. That conversation, 5 minutes of your time, could matter more than you will ever know. Subscribe to this channel because this is exactly what I do here. I cut through the noise and bring you research-backed health information that is specific, honest, and genuinely useful. The kind of information that belongs in your doctor's office, but too often does not make it there in time. In my next video, I am going to show you the 5 early warning signs that your coronary arteries are narrowing. Signs that research shows can appear months or even years before a heart attack. And the exact questions to ask your doctor today to find out where you actually stand. You will want to see that one. I will see you there. This video is for educational and informational purposes only and is not intended as medical advice. If you are experiencing chest pain, sudden severe leg pain, or any symptom you believe may be a medical emergency, call emergency services immediately. Never ignore or delay seeking professional medical care based on anything you hear in this video. Always consult with a qualified healthcare provider before making any changes to your health management plan.